Margaret is 67. She has Medicare. Last year, a course of treatment left her paying about $10,000 out of her own pocket. Here is the part almost nobody knows until it happens to them. There was no limit on how much higher that could have gone. Original Medicare has no out-of-pocket maximum. None. Whatever the bill comes to, you owe 20% of it. And 20% of an unlimited number is an unlimited number. That one fact is why Medicare has the shape it does. The letters everyone finds so confusing, A, B, C, and D, exist either to create that gap or to close it. So let me do the letters properly once. Then the gap in the middle of them. Then the two ways out. Because there are two ways, not four. The handbook says it plainly. There are two main ways to get Medicare. A and B are the foundation, and together they are what people mean by original Medicare. C is not a fourth thing you add, it is an alternative way of receiving A and B. And D is prescription drugs, bought on its own or already bundled inside C. Part A first and quickly. Part A is hospital insurance. Inpatient care, skilled nursing, hospice, and some home health care. For most people it costs nothing. If you worked and paid Medicare taxes for at least 10 years, Part A is free. The handbook calls it Premium-Free Part A, and you may also qualify on a current or former spouse's record. But free does not mean it pays everything. Go into hospital and Part A has a deductible. In 2026, $1,736. And here is a detail almost nobody knows. That is not once a year. It is once per benefit period, and a new benefit period can begin more than once in the same calendar year. Now Part B. This is where the money actually lives. Part B is medical insurance. Doctors, outpatient care, home health, equipment, preventive services. In 2026, the standard Part B premium is $202.90 a month. Higher earners pay a surcharge on top called IRMAA, and that has a video of its own. And here is something worth knowing before we go any further, because it catches people out badly. If you are already receiving Social Security at 65, you are enrolled in Part A and Part B automatically. Both of them. So if you are still working and you meant to delay Part B, you have to say so before the start date printed on your Medicare card. In the handbook's own words, if you do nothing, you will keep Part B and pay Part B premiums through your Social Security benefits. The money simply starts coming out quickly and necessarily. This channel is educational only. This is not financial, tax, or legal advice, and I am not a registered investment advisor. Every figure here comes from the official Medicare and You Handbook for 2026 and from the Social Security Administration's published pages. Both are linked below. Part B also has a yearly deductible. In 2026, that is $283. And then the number this entire video turns on. After that deductible, for most Part B services, you pay 20% of the Medicare-approved amount. Medicare pays $80. You pay $20. 20% does not sound like much. So let me show you what it actually means. Back to Margaret. Original Medicare, Part A and Part B, nothing else. In March, she spends 5 days in hospital. The hospital stay itself is straightforward. She pays the Part A deductible, $1,736. 5 days sits well inside that first 60-day window, so nothing more for the stay. Then comes everything else: the surgeon, the anesthetist, the follow-up appointments, the physical therapy, the scans. All of that is Part B. Say those come to $4,000 of Medicare-approved charges. She pays the $283 deductible, then 20% of the remaining $3,717. That is $743. Her Part B share is $1,026. With the hospital deductible, about $2,762. On top of her premiums, which run another $2,435 across the year. One caveat on that 20%, and it matters. It assumes your doctor accepts what Medicare calls assignment. If they do not, they can charge you up to 15% above the approved amount, and that sits on top of your 20. So that was a manageable year. Now change one thing. Suppose the Part B side runs to $40,000 across a long course of treatment. She pays the deductible, then 20% of $39,717, nearly $8,000. With the hospital deductible, close to $10,000 out of pocket. That is where the $10,000 came from. And now the sentence I opened with, in the handbook's own words. There is no yearly limit on what you pay out of pocket, unless you have supplemental coverage. No limit. Not a high one. None. However large the bill gets, your 20% keeps pace with it. That gap is why Parts C and D exist in the shape they do. There are two ways to close it, and one of them is very hard to undo once you have chosen it. The first way: you keep original Medicare, Parts A and B, and you buy coverage to sit on top. A separate Part D plan for your prescriptions. And a Medicare supplement policy, which nearly everyone calls Medigap, to cover that 20%. On this path, you can use any doctor or any hospital in the country that takes Medicare. And in most cases, you do not need a referral to see a specialist. You usually pay more in premiums each month, and you are buying predictability with it. The second way is Part C. Part C is Medicare Advantage, and this is the one most people misunderstand. It is not an addition to original Medicare. It is a replacement for how you receive it. A plan from a private company approved by Medicare that bundles your Part A and your Part B together, and most include Part D as well. Many add vision, hearing, and dental, which original Medicare does not cover at all. And crucially, Advantage plans have a yearly limit on what you pay out of pocket. That is the gap being closed. Once you hit your plan's limit, you pay nothing more for covered hospital and medical services for the rest of the year, though in-network and out-of-network limits can differ. Two things come with that. You may need to use doctors in the plan's network, and you may need approval or a referral for certain services and drugs. And if you are on an Advantage plan, you cannot buy Medigap to cover your costs. That is the part that is hard to undo, and it is why this choice gets its own video. You will also see Advantage plans advertised at a $0 premium. Usually true and always incomplete. In almost every case, you still pay your Part B premium, and the zero refers only to the plan's own premium on top of that. Some plans do pay part of your Part B premium back to you, which the handbook calls a Part B premium reduction, but that is the exception, not what the zero means. Which brings us to Part D. Part D is prescription drug coverage sold by private companies that Medicare approves. You can buy it standalone alongside original Medicare, or get it bundled inside most Advantage plans. And there is one 2026 figure here worth knowing because it is new. Your out-of-pocket costs for the drugs your plan covers are now capped at $2,100 for the year. That scope matters. A drug your plan does not cover does not count towards the cap and is not protected by it. Once you reach the cap, you pay no co-payment or co-insurance for covered Part D drugs for the rest of the calendar year. So briefly, A and B are original Medicare, and between them they leave you owing 20% of most of it with no ceiling above it. C is a different way of receiving A and B that puts a ceiling on it in exchange for a network. D is drugs on its own or inside C. The decision was never which letters to collect. It is which of the two paths you are on. Here is what you can check today without talking to anyone. A Medigap policy means you are on the first path. An Advantage plan means you are on the second. Only parts A and B and nothing else means you are carrying that 20% yourself with nothing above it. And that is worth knowing deliberately rather than finding out in March. When to sign up, the deadlines and the penalty that never goes away are their own video. It is coming this week. If this was useful, subscribe. I publish one of these every weekday morning. No products, no commissions, just the math.